Welcome to the Dr. Carolyn Coker-Ross Show. I'm Dr. Carolyn, and I'm a medical doctor who specializes in treating eating disorders and addictions. I've been working with individuals with binge eating disorder, compulsive overeating, food addiction, and emotional eating for over 20 years. I'm also the founder of the Anchor Program, an international online non-diet coaching program for people with food and body image issues that you can access from the comfort of your own home. Please check out my books, the Emotional Eating Workbook, the Binge Eating and Compulsive Overeating Workbook, and my latest book, the Food Addiction Recovery Workbook. I'm on a mission to help individuals just like you transform your relationship with food and with your body. Today we have a fascinating guest, Dr. Roberto Olivardia, and a fascinating topic. We'll be talking about eating disorders in men. So welcome to the show, Dr. Olivardia.
Oh, thank you for having me. It's a pleasure.
Let me tell my listeners a little bit about you. You have a very distinguished resume, but I'm just going to give a snippet of that. Dr. Roberto Olivardia is a clinical psychologist, lecturer in psychology in the Department of Psychiatry at Harvard Medical School, and a clinical associate at McLean Hospital. He maintains a private practice in Lexington, Massachusetts, where he specializes in the treatment of eating disorders and body image issues in boys and men. He is the co-author of the book, The Adonis Complex. When I worked at Sierra Tucson as the head of their eating disorder program, we actually had quite a few men who came in for treatment. And it is interesting that men do have different body image goals, so to speak, or ideals than women. For women, it's mostly the thin ideal, and that's pretty much it. But tell me a little bit more about what you know about body image ideals for men.
Sure. So what I found in certainly my practice is that there's a whole spectrum of what you see. So I work with boys and men with anorexia who do restrict their calories and lose a lot of weight. However, even in that population, a lot of times, most of the males that I've worked with will not endorse the sort of item that they want to be skinny per se, but they're really striving to be lean. And so a lot of them may actually even know that they look unhealthily thin or emaciated. And for a lot of the men that I work with, their ideal would be to be very lean, but also look fit. So to have maybe a six-pack of abdominal muscles, to be very cut in terms of their muscularity. However, we can't gain muscle if we have no fat on our body. And so the conflict for a lot of these men who struggle with anorexia is that they need to eat in order to create muscle. And what they will often say to me is, if you can guarantee that this food will turn into muscle, I have no problem with being overweight as long as I'm not over fat. And that's very different dimensions that we see. Typically with women, that concept of being overweight and over fat are sort of one and the same. And with men, if you think about most bodybuilders are actually overweight technically, but they have very low body fat percentage.
Yeah, by BMI, they're overweight. Like
exactly.
I think Arnold Schwarzenegger is a great example because by BMI, he's considered obese, I think.
Right, exactly.
Yeah. But he's all muscle, at least he was in his younger days.
Exactly. And so I work with men on that end of the spectrum. I work with men who compulsively lift weights, who might take steroids to make themselves look really muscular, really fear sort of losing any kind of muscle mass and want to be very big, again, in a more muscular way. So we're not talking about big in terms of obesity in that. And then I work with a lot of men who have eating disorders who don't have body image concerns, that their eating disorders come from obsessive compulsive disorder, maybe wanting to eat healthy, which might include not being overweight, but not for an aesthetic reason. But
so is that the orthorexia?
That's more the orthorexia, exactly.
Yeah. So they may overeat, but they only eat clean, as the new term is, or healthy.
Exactly. Or they might undereat for that
Yeah,
same reason because
exactly.
there are so few foods that don't have preservatives or things like that, and it can get very obsessive compulsive.
Yeah. Well, how common though are these issues in men? I mean, we always talk about them in women, and the ideal has been that women have eating disorders, and usually Caucasian women. And now we're starting to see or to recognize that there are eating disorders in women of color. But I don't think there's still a lot of recognition about men and eating disorders or body image issues. So, how common are these problems?
Yeah, much more common than people would think. I mean, it's interesting that when I started doing this work almost 25 years ago, that people, even my thesis committee, I did senior honors thesis in college on eating disorders in men, and my professor said, well, you might want a plan B just in case you don't get enough men to recruit for, because I had put ads in college newspapers for
Hmm.
men who basically struggle with eating disorders. And to their surprise, that I didn't have to have a plan B. I had lots of men who responded
Mm.
to it. And nowadays, people are still shocked by that. So studies will find that there's a huge disparity between the number of men in the community at large who struggle with eating disorders versus the number of men that walk through a clinician's door or present in a treatment program. So approximately 1 in 16 to 20 patients with eating disorders are male. So those are
Okay.
people that are in outpatient and residential programs and
But is it the
inpatient.
full spectrum of eating disorders, anorexia, bulimia, binge eating, and
Yeah,
OSFAT or other specified feeding and eating disorders?
typically what you would see for a lot of the more intensive programs that men will is more anorexia or severe bulimia. Binge eating disorders still something that there's a big disparity of men out there who struggle with it versus seek treatment for it. And what studies show in the community is that 1 in 4 people who struggle with an eating disorder in the community are male. So there are a lot of men out there who are struggling with eating disorders that either A, don't seek treatment for fear of just embarrassment or shame, a lot of sort of the stereotypes that people still have about men who struggle with eating disorders, whether they're necessarily gay, whether it's something about their sexuality. And certainly I've treated many men who are gay who struggle with eating disorders, but the majority of men I've treated with eating disorders don't identify as
Mhm.
gay. And for certainly, if you look at the literature in the late 70s, early 80s, all of those studies said that being gay was a risk factor for men to
Mhm.
develop an eating disorder. And we find that that's actually not true. It's just that the first studies that I would do on men with eating disorders found that gay men were more likely to seek treatment for their eating
Okay.
disorder.
And that makes more
And
sense.
therefore they're going to be overrepresented in that. And that's not to say that in the gay community that there aren't specific issues that take on sort of different dimensions in that community, but a lot of men who struggle, they really feel there's a lot of stigma around it. People
Mhm.
thinking, oh, you're a guy and you have an eating disorder. Lots of men actually don't even know where to go. I mean, there are a lot of programs that don't accept men, male patients who have eating disorders. There aren't a lot of treaters that put as an area of specialty that they work with men. And so
Mhm.
one of the benefits of having done this work for so long, and then when we wrote Adonis Complex in 2000, that book was very, very helpful in just getting the message out there. And so a lot of men that I see, I'm sometimes the only, certainly the first, and sometimes the only person that they've ever disclosed that they had an eating disorder for the
Wow.
adult men that I work
Yeah.
with.
Well, let me ask you a question about binge eating disorder because about 40% of all the people with binge eating disorder are males. And
Yes.
that category it has more people in it than anorexia and bulimia combined. And yet it seems like big men living in larger bodies, are not stigmatized in the way that big women, women living in larger bodies are. There's those comments like, oh, he's just a big guy, or he's just a
Yes.
growing boy, or he really likes his food, but it doesn't seem to be as big of a stigma. Is that been your experience?
Yes and no. So definitely in terms of body image, that I agree with you that men in larger bodies are not going to be as discriminated or as stigmatized as women in larger bodies, without a doubt. The issue, though, however, is that these binge eating disorder is vastly under-identified with men because of that, but because of this notion that, men eat a lot and that, big men, it's okay for them to eat a lot. Or if a teenage boy has binge eating disorder, I've seen this number of times where parents almost sometimes celebrate like, oh, he's a hearty eater. But then there's that sort of line that gets crossed that says, wait a minute, this seems like it's a bit out of control. And so it's harder, I think, for men, even men themselves and boys that I've worked with, to identify that there's a problem, because they'll often say, I feel like there was something off and wrong with it, but if other people around me, because a lot of people binge in private, but
Yes.
even with some of the men that I've worked with who basically are kind of more publicly binge, that they don't get any concern from people around them.
Yeah, and it's more okay to
Yes,
publicly eat a lot if you're a man, whereas
definitely.
most women eat much less when they're in public, even if they may binge in private.
Exactly.
Mhm.
And I've worked with a lot of men who will eat a lot in public and then also privately binge eat.
Yeah.
So
So
it's
what
harder for
actually
them.
brings them into treatment? What is the, for women, it's that feeling of being out of control and having to hide, and the embarrassment of, and also the stigma. Well, what is
Yes.
it that would bring a guy who's a binge eater into treatment?
It's usually a lot of, a number of them, it's for health reasons that
Okay.
they've developed sometimes like acid reflux, or I'm working with a male now, he's in his late 30s, who he would basically, he had really severe gastroesophageal reflux disorder where he
Mhm.
would vomit in the middle of the night
Oh,
because he would
goodness.
binge eat at nighttime and go to bed and basically almost pass out because he was
Mhm.
so exhausted, probably all the calories he was eating. And then he'd wake up in the morning and he would just, wake up to a puddle of vomit. And so he said, that's obviously there's something wrong with that. So sometimes it could be health issues. And a lot of times these men know that it's out of control, that they'll say, incidentally, I've worked with a number of men with bulimia or binge eating disorder who are in recovery for addiction, for whether it's alcoholism or some other kind of drug addiction. And they'll often say, this feels like my new drug.
Yes.
People around me are saying, oh, I'm just a heavy eater, I'm a hearty eater, but I don't know how to explain to people, but this feels like my new cocaine. And that's very common. I
And
work,
it's common in women, that co-occurring addictions
yes.
with binge eating and bulimia and also anorexia, but a higher rate with anorexia and bulimia, that they will have co-occurring, alcohol or drug problems.
Right. And then a number of men, one of my other areas of specialty is in the treatment of attention deficit hyperactivity disorder, or ADHD, which is an area I do a lot of work in. And there's a large comorbidity between ADHD and bulimia, or ADHD and binge eating disorder. It's interesting. The only FDA approved medication for binge eating disorder is Vyvanse, which is
Right.
an ADHD medication. It's a
Yeah.
stimulant.
Now, in women, we see also a high incidence of trauma. Do you see that in the men you're treating?
I see it, but I wouldn't say it's the majority of men that I work with.
Well, let's broaden the definition of trauma, because when I've worked with men, they may not have identified themselves as having a history of trauma, when in point of fact, things like, my dad was a raging alcoholic,
Mm-hmm.
or, I've always felt like I had a hole in me. Those are the kinds of things I've heard from men, not necessarily, I've been sexually abused, but maybe physical abuse. They may not recognize emotional abuse. So when you probe, do you get any different results on the trauma issue?
Sometimes, certainly that, I'll hear a lot of emotional abuse, sometimes physical and sexual abuse, severe bullying and teasing around appearance. And then other times, there's no history of any of that. And one of the things that I think, because of my area of expertise with ADHD, I see a lot of people that come in with ADHD, and they don't come in for their binge eating problem. They come in because of other executive functioning issues and impulse control issues. And then I run down the list of all the different impulse issues, and it turns out one of them might be eating. And then as I do further assessment, it turns out they have binge eating disorder, but never sort of thought of or conceptualize it as an eating disorder. They really conceptualize it as just yet another thing that they're very incredibly impulsive around. So that's sort of another piece. But absolutely, I mean, with trauma, that it can absolutely come in a lot of different forms. Sometimes the trauma is in abandonment. I'm working with people who don't have, maybe whose father or mother died at a young age, or didn't have a certain level of emotional nurturance, and food is very nurturing.
Or someone whose mother or father also had an eating or body image issue. And I've heard so many men talk about bonding with their mothers over food. Well, my mom used to bake me this bread, and she and I would sit at the table and we'd eat buttered bread and talk about, things. And that created a sense of connection. And it was all around food, was another way that can happen. But I don't know if you've been talking to your clients about historical trauma or intergenerational trauma, but I've also seen binge eating disorder, bulimia, and so on be related to traumatic experiences that happened in the previous generation, and then the parent from their trauma, which then causes these impulsive, or there may be epigenetic memory, as some people call it, that can create these impulsive and compulsive behaviors.
Absolutely. Yeah, it's not uncommon when I mean, because we do know that there are genetic, heritability around, whether it's eating disorders or, as you were mentioning, obsessive compulsive traits or impulsivity in the case of things like ADHD. And with a lot of the boys that I work with, it's interesting, the relationship with their father, or lack thereof sometimes, is often a very prominent one, particularly for the men who struggle with wanting to look muscular, with wanting to look fit, this idea of having this kind of concrete expression of masculinity, how we, societally define masculinity as being fit and muscular and strong. And sometimes I've worked with boys whose fathers absolutely have very negative relationships with their own bodies, and that sort of gets transferred. And sometimes with, moms or parents in general, I mean, one of the things that's interesting is a lot of the men that I work with might have had a sibling, a sister, that struggled with an eating disorder. And a lot of times parents will say, you are always taught, oh, be careful of how you talk about dieting and about food and about your body in front of your daughters. You don't want to sort of be a negative role model. And for fathers, be aware of how you're talking about women, in front of your daughter, and what messages she internalizes. And parents will often say, I never thought that way about my son in terms of what messages he might be getting. And, even for moms who might be very negative about their own bodies, the idea that that's not impacting their son, just because their son is of the opposite sex, doesn't mean that they're not learning messaging around the value of the body and about appearance. And that absolutely can be impactful.
Yeah. So what's the impact of media images? Because I know in girls, I feel, and I'm not sure how much research supports this, but I think there's a vulnerability in certain girls, particularly those who have had trauma in their background, or abandonment or loss, who don't have a great family support system, that they may be more vulnerable to the impact of seeing the thin ideal in media images. And I know that even men's magazines are now starting to portray some of these ideals for men. So what do you think the impact is in the clients that you're seeing of the media?
Yeah, that actually, and I've done research on this that have looked at how different and how that has really been historically very different for men than for women. So prior to the 1980s, we didn't really see unclothed men in advertisements, that the sort of ideal male was always portrayed as tough and rugged and strong, like the Marlboro man. He didn't show any skin, but he was a cowboy, and he was very like John Wayne type and that sort of type. Then in the 80s, something started to shift where, if you think about the biggest movie stars of the early 80s, Arnold Schwarzenegger, Sylvester Stallone, Jean-Claude Van Damme, the action movies, their bodies were huge commodities. Bodybuilding was something that went from elite circles and these random kind of private gyms to sort of more, the fitness boom that happened in the 80s, from aerobics, but for men. Steroids also became much more infiltrated sort of into popular culture. And so now, I did a study in the late 90s that we looked at, instead of the Barbie doll, which we all know, that wonderful study in 1980 that showed if the Barbie doll were a real life human female, her dimensions would be totally unrealistic.
And she wouldn't be able to stand up straight because...
Exactly. And so we did a study looking at G.I. Joe action figures over the decades, and we found that they're markedly getting more and more and more muscular. And in fact, at that time, the study we did in 97, I think, or 98. And the current G.I. Joe figure also couldn't stand up straight because he was so muscular that his dimensions would be totally unrealistic unless he was doing anabolic steroids. And so if you look at these men's magazines, even though they might not be these quote unquote unhealthy images of sort of thin, emaciated images, which is what you're not going to see in most men's magazines. However, you're going to see men a lot of whom also are subject to very disordered eating to achieve, that six pack, to have, virtually no fat on their face so that they can have a very chiseled jaw, to be very muscular, to be, fit. And with the boys that I work with, even young boys, they're absolutely inundated by these images. And with social media, I mean, that has put just gasoline on the fire. I mean, having been in doing this work pre-social media and now doing the work now, that is absolutely elevated. I mean, for both boys and girls, elevated, concerns, because now it's not just celebrities you're comparing yourself to. It could be photoshopped images of yourself that you're comparing yourself to. And what's interesting, though, is I remember some years ago, I spoke to a group of seventh graders in this school for health class. And it was just seventh grade boys. And my colleague spoke to the girls. And I said, how many of you feel like you're affected by these images of the quote unquote perfect male body? And all of them said, oh, I'm not affected by that at all. Like, oh, that's stupid. Like, only girls are affected by that. However, a number of them said, but all my friends are affected by that. But I'm not. And one of them, it was striking because one of them was this boy who just adamantly denied that he's impacted by any of that. And again, if you think about it, like, it's already stigmatizing for boys to even admit that they could be internalizing these images and feeling bad about their bodies, to have a conversation with other boys. I mean, even though it's so tragic how normative body dissatisfaction is amongst girls, there's a dialogue often amongst girls about it, and that they talk about it. So here's this boy who adamantly denies that he's impacted by this, and yet he's wearing these jeans with no belt that's sort of sagging down a little bit, enough that you can see that he's wearing Calvin Klein underwear. And I'm thinking, because one of the things I talked about was how Calvin Klein, really, they're brilliant at what they do in their marketing, because they got men to spend $8 to $10 for a pair of underwear. Like, that never happened in the sort of more heterosexual market.
Men's underwear was not a topic of marketing really in the past.
No, it was Hanes or Fruit of the Loom. That was it.
Yeah, that's right.
And to hear that he said that, and yet it's like, I don't think that boys or men have caught up yet to totally understand how they are internalizing it.
Yeah. So what are the biggest obstacles you see to men getting treatment? I know there aren't a lot of places for them to go. more for anorexia, I think, than say for binge eating disorder. But what other obstacles do you see?
Yeah, I think first and foremost is really the shame that a lot of men have around it. The other obstacle is in outreach. I think that we, as a mental health community, as a medical community, college campuses have to do a better job at outreaching, as you mentioned at the top of the show, to the Caucasian women that have eating disorders, but also to women of color, of ethnic minority, to sexual minority communities, and men are included in that. I consult with Harvard University. They have a wonderful service. It's called ECHO. It stands for Eating Concerns Hotline Outreach, and it's a 24-hour confidential line that college students can call, and they have trained peer counselors to talk about food related concerns and help them get services. And I've consulted with them over a number of years because they wanted to know how they can better outreach to male college students.
Right.
And lo and behold, when they started doing that outreach, they started getting more men calling. And so it's not that men out there are not struggling with it. They just think they're going to be the anomaly calling the hotline that they assume that these peer counselors have only heard, from women.
And that if they go into a treatment program, they're going to be put in with women, which doesn't always feel comfortable to men.
Right. And a lot of times that's the case. I mean, with many of the men, when I recommend a program, they'll say, do you think, and now for some of the men, it really doesn't matter. They'll say, I really don't care if I'm the only guy there. I just want help. They've gotten to a place, it's just they've hit bottom. But for particularly the adolescent boys that really need that intensive help, there is more of a self-consciousness often, and sometimes they might be the only male, and that becomes part of the treatment, is how they see themselves as a result of that, and understanding that this disorder doesn't really have any category when it comes to gender or ethnicity or socioeconomic status, and how to sort of work with the shame, that might be around that. And a lot of times, actually, what's been great to see is when young men come out of programs like that, they feel a sense of empowerment. And a lot of the young men that I've treated who are in recovery really feel the need to sort of put it out there and try to educate people and educate their peers too about how to outreach and how to talk to people about their struggles with this.
Yeah, and there have been some people who shared their experience in books that I know of where they talk about their own journey to healing from bulimia or binge eating disorder. So there's more out there. Well, it's been great talking with you, Dr. Olivardia. Wonderful work that you're doing, and I'm hopeful that this helps get the word out as well. So men do have eating disorders, and it can affect them in the same way that it affects women.
Yes.
And we need to really talk about it more and help people get the help they need.
Yes, and thank you. And I appreciate you doing this show, because this is part of that. I mean, this show, and just all it takes is one person to hear this and think, wow, okay, I'm not the only one, and there's help out there.
Yeah, absolutely. Okay, well, thanks again.
Thank you.
This is Dr. Carolyn Coker-Ross. Thanks for listening to the podcast. I would really appreciate it if you'd leave a review for our podcast so we can get the word out about what we're doing. So today's show was on eating disorders in men, and maybe you have sons or husbands or brothers, relatives in your family who may have an eating disorder but are being told that those same things that our guest was talking about, that, oh, men just eat a lot, or it's okay, he's a growing boy. But if his overeating continues, you might want to refer him to the National Association for Males with Eating Disorders. That's National Association for Males with Eating Disorders. So think about also, if you are struggling with an eating disorder, think about the kinds of messages. If you have body image issues or shame around your own eating disorder, think about the kind of messages that you may be passing along to your sons or younger male figures in your family. And you can get help for yourself, which always helps your family. So we'll have Great stuff coming up on the next podcast. Information about core beliefs and how to change that negative self-talk in your head that just keeps bugging you and bugging you. We'll be talking about body hatred and more coming up on the Dr. Carolyn Coker-Ross Show. Thanks for listening.